you picture someone with ADHD, who comes to mind? If you're imagining a hyperactive 7-year-old boy bouncing off classroom walls, you're not alone. That stereotype has dominated our understanding of ADHD for decades. But here's the problem. That narrow image is leaving millions of girls and women in the shadows, struggling without diagnosis, treatment, or support. The numbers tell a sobering story. Boys are diagnosed with ADHD at a rate of 3 to 1 compared to girls during childhood. Yet by adulthood, that ratio narrows to nearly 1 to 1. This dramatic shift reveals a troubling truth. We're not missing ADHD in girls because it's less common. We're missing it because we're not looking for it in the right ways. Even more alarming is that studies estimate that 50% to 75% of girls with ADHD go undiagnosed. And when they are finally identified, it happens an average of 5 years later than boys. Boys at age 7 and girls at age 12. That's 5 critical years of struggling in silence, internalizing failure, and missing the support that could change the trajectory of their lives. Welcome to Insights from Insight, Understanding Minds and Supporting Growth, a resource from Insight Education Academy. Before I dive into the research, I want to share what I witnessed during my 22 years teaching in public schools, particularly at a college prep school where many of my students were gifted and highly intelligent. I saw a pattern over and over again. Bright girls, girls who were identified as gifted, girls who participated in class discussion, girls who clearly understood the material and would turn in essays that were all over the place. Their ideas were brilliant, their analysis was sophisticated, but the organization, it was chaos. I'd find topic sentences buried in the middle of body paragraphs. I'd see arguments that jumped around without clear transitions. If these students could have just copied and pasted their sentences to rearrange them, they would have scored significantly higher. But it was before digital exams, so that wasn't an option. In advanced placement courses, essay structure isn't just a preference, it's directly tied to scoring. And for these girls, their organizational struggles were heavily impacting their potential success on exams. This pattern actually inspired one of my favorite lessons. I would take an essay, cut up the sentences, and have student groups put the essay together like a puzzle. That explicit teaching of organizational structure was extremely helpful for all of my students. But here's what troubled me. I would suggest to families that their daughter might have ADHD, and I would spend hours, literally hours, working with these students on executive function skills, like organization and time management, and of course planning. Yet they would rarely get an ADHD diagnosis. Why? Because most of these girls were already identified as gifted, and their deficits in organizational skills were explained away as giftedness, as if being smart somehow meant they couldn't also have ADHD. The other sign I consistently saw, not finishing assignments or multiple choice exams. These were girls who knew the material, but they'd run out of time. They'd get stuck on one question and lose track of the clock, and they'd second-guess themselves endlessly. I cannot even tell you how many of these students have reached out to me as adults, years, sometimes decades later, saying they finally got an ADHD diagnosis, a lot of them in college. It wasn't a rare enough occurrence for it to not be indicative of something systemic. We were missing ADHD in these girls, and we're still missing it today. So why are we missing so many girls with ADHD? The traditional image of ADHD, the disruptive, hyperactive child who can't sit still, was built almost entirely on studies of boys. This male-centered understanding has created diagnostic criteria and screening tools that simply don't capture how ADHD presents in many girls and women. Girls with ADHD are more likely to present with things like inattentive symptoms, rather than the hyperactive impulsive behaviors. They internalize struggles like daydreaming, disorganization, and emotional sensitivity. Quiet symptoms that don't disrupt the class but devastate the individual. As one woman described in research, I always thought there was something wrong with me, but I couldn't really put my finger on it. While boys with ADHD might leave their seats, interrupt lessons, and demand attention, girls often express their restlessness through nonstop talking, fidgeting with objects, or internal mental hyperactivity that goes unnoticed. They're not causing problems for teachers, so teachers don't flag them for evaluation. Here's where the gender gap becomes particularly insidious. Girls with ADHD often work exponentially harder to appear normal. Research found that children with higher cognitive ability, better prosocial skills, and fewer behavior disruptions were significantly less likely to be diagnosed with ADHD, even when they had clear symptoms and functional impairment. In other words, the very girls who are compensating most successfully for their ADHD are the ones we're most likely to miss. One university student described this exhausting reality. I remember being at a parents' evening when I was 11 years old, and the teacher told my parents that I was on the verge of burnout if I kept working as much as I was. An 11-year-old should not be burnt out. Think about that. An 11-year-old burnt out? This pattern of overcompensation continues into adulthood. Girls and women with ADHD often develop perfectionist tendencies to mask their organizational struggles. They choose careers or lifestyles that accommodate their symptoms without recognizing why. They experience chronic exhaustion from the mental effort required to function at the same level as their peers. And they internalize failure as personal inadequacy rather than recognizing a treatable condition. The emotional toll is staggering. Women in research studies consistently describe profound struggles with self-esteem, with one woman explaining, "I really felt myself being inferior to other people, I suppose, and I always had a feeling that I wasn't good enough. You're thinking, what is wrong with me? Why can't I do that? Why can't I be as organized as other people?" Let's talk about some of the specific ways ADHD shows up differently in girls, ways that our current diagnostic criteria often miss. One of the most significant findings from recent research is the role of emotional dysregulation in ADHD, particularly in females. Research found that males with recognized ADHD were more likely to have higher emotional dysregulation than unrecognized males, but this pattern did not hold for females. In other words, emotional dysregulation helped identify ADHD in boys, but not in girls. Even though females with both recognized and unrecognized ADHD showed significantly higher levels of emotional dysregulation compared to females without ADHD. This includes symptoms like rejection-sensitive dysphoria, intense emotional pain from perceived rejection or failure, rapid mood shifts throughout the day, difficulty managing frustration or disappointment, emotional outbursts that seem disproportionate to the situation. Yet emotional dysregulation is not included in current DSM-5 diagnostic criteria for ADHD, despite being present in an estimated 99% of adults with the condition. This omission particularly disadvantages females, whose ADHD presentations often center on emotional and interpersonal struggles, rather than visible behavior disruptions. Girls with ADHD face unique social challenges that often go unrecognized. Research shows they commonly experience difficulty maintaining close friendships, despite having many acquaintances. They have social rejection due to being too much. They're too talkative, too intense, too bossy. Or they're misreading social cues and struggling to navigate the complex, unwritten rules of female peer groups, or people-pleasing behaviors that mask their struggles while depleting their emotional resources. As one researcher notes, the rules for boys' play are less stringent. Their games are more physical. But for girls with ADHD, if they don't receive help and guidance, self-esteem can take a pummeling. One woman described this painful reality. "I believe that people had to put up with me, instead of enjoying my company, and I felt like I had to apologize for the way that I was." Here's something that might surprise you. Not all girls with ADHD struggle academically in childhood, and this actually works against them. Research found that children with higher cognitive ability were less likely to have their ADHD recognized, perhaps because they're able to master their difficulties or because their underperformance relative to their ability goes unnoticed. This was exactly what I saw in my AP classroom. These girls were smart enough to compensate until the demands became too high. Many girls with ADHD excel in subjects they find interesting while struggling with those that they don't. They work exponentially harder than peers to achieve the same results. And they don't show academic difficulties until higher education, when increased demands and reduced external structure overwhelm their coping mechanisms. As one woman explained, "I was great in the subjects that I was good at, which was usually the more creative ones. And it's not to say I did really badly in other subjects. I was capable of doing it, but I just couldn't focus to do it. So I refused to do the work. This pattern means a traditional red flag for ADHD, poor academic performance, often doesn't appear until it's too late, or if at all. The consequences of missed childhood diagnosis extends far into adulthood. Research reveals that adult ADHD is frequently misdiagnosed or missed entirely in general psychiatric settings, despite affecting 2.5% to 4.3% of the adult population. Several factors are contributing to misdiagnosis in adults. Many still view ADHD as an exclusive childhood disorder, despite robust evidence of its persistence into adulthood. As one healthcare professional noted, it's not something that you're taught about, and it's something actually even a bit of frowned upon, that it doesn't exist or that sort of thing. Symptoms present differently in adults. What appears as hyperactivity in children appears as inner restlessness, over-talkativeness, or an inability to relax in adulthood. Without understanding this evolution, professionals may not recognize ADHD in adults who don't present with obvious hyperactive symptoms. There's often comorbidity confusion. An estimated 75% of adults with ADHD have at least one other psychiatric diagnosis, including depression, anxiety, a substance use disorder, and personality disorders. These comorbid conditions often overshadow ADHD symptoms, leading to treatment of secondary conditions while the underlying ADHD remains unaddressed. And adults are really great at masking and compensating. Adults with ADHD often develop sophisticated coping mechanisms that hide their struggles. They choose fast-paced careers that suit their need for stimulation, or they are relying on partners to manage organizational tasks, or they're self-medicating with caffeine, alcohol, or illicit substances. One woman described this reality. "I've got a friend who has ADHD, and she noticed a lot of similarities between us. I sort of had a suspicion that it might be ADHD, but I didn't bother following up with it because it seemed like a lot of work. And at the time, I didn't think it was impacting my life that much." The consequences of undiagnosed ADHD in adulthood are severe and far-reaching. Research documents what they call a life of perpetual failure for adults with unrecognized ADHD. The occupational impact for adults with undiagnosed ADHD is poor work records and frequent job changes. They also experience reduced productivity and increased absenteeism, and they have difficulty with time management and meeting deadlines, and they are often underemployed relative to their intellectual ability. The interpersonal consequences are that there are relationship and marital struggles. There's social isolation and friendship struggles. Parenting is a challenge, and there's an increased risk of domestic violence, victimization, particularly for women. The mental health toll is at 2.3 times higher risk of co-occurring mental health conditions exist in adults with undiagnosed ADHD. There's an increased rate of anxiety and depression. There's a higher risk of eating disorders, particularly in women, and there are elevated rates of self-harm and suicidal ideation. Adults with undiagnosed ADHD also engage in high-risk behaviors, things like increased substance abuse, not from medication, but from self-medicating untreated symptoms. They have higher rates of smoking and alcohol use. They have increased risk of accidents and injuries, and they're 2.4 times greater likelihood of arrest. And there's a 42% reduction in violent recidivism when ADHD is properly treated. As one healthcare professional poignantly described, if you look back into their life, then you can see the checkered work record, relationship failures, the substance abuse, the disruption in their life, and the poor financial management over time, and the comorbidities that interfere over time. That is an enormous cost for that person and for their families. So what do we do about all this? How do we stop missing girls and women with ADHD? One is to expand diagnostic criteria and screening tools. Current ADHD diagnostic criteria and screening tools were developed primarily based on male presentations. We need gender-inclusive diagnostic guidelines that recognize inattentive presentations and emotional dysregulation. We need screening tools that validate for females across the lifespan. and we need to recognize that ADHD can exist alongside high achievement, good social skills, and cognitive ability. And finally, inclusion of emotional dysregulation in diagnostic considerations. The knowledge gap among healthcare providers is a critical barrier. We need mandatory training on ADHD in medical and psychology programs, with a specific focus on gender differences and adult presentations. We need continuing education requirements for practicing professionals, clinical guidelines that address the full spectrum of ADHD presentation, and awareness that ADHD should be considered regardless of academic performance, pro-social skills, or absence of disruptive behavior. We also need to work to combat stigma and misconceptions. Stigma remains a powerful barrier in diagnosis and treatment. Public awareness campaigns must challenge the stereotype of ADHD as a hyperactive boy disorder. We need to highlight the real-world consequences of untreated ADHD, and we need to share stories of successful treatment outcomes. We also should emphasize that ADHD is a legitimate neurodevelopmental condition, not a character flaw or parenting failure. Even when diagnosed, many individuals, particularly women and adults, face barriers in treatment. Comprehensive care should include pharmacological treatments with access to both stimulant and non-stimulant medications, insurance coverage that doesn't arbitrarily end at 18, and recognition that medication for ADHD has an effect size of 0.6 to 0.9, significantly higher than antidepressants. We also need psychosocial interventions, things like cognitive behavioral therapy, skills training in organization, time management, and emotional regulation, coaching and support services, and family education and therapy. We also need to do workplace and educational accommodations, understanding of ADHD as a legitimate disability in order to create reasonable accommodations in academic and work settings, and support from occupational therapists for workplace integration. We also need to prioritize early identification in girls. Teachers play a crucial front line in identifying ADHD. And here's what teachers should look for. Go beyond the hyperactivity. Notice a girl who talks nonstop, even after being asked to stop. Pay attention to the spacey student who seems to drift away during instruction. Recognize that fidgeting with objects can be a sign of hyperactivity. We also need to address social struggles in girls. Notice girls who struggle to maintain friendships despite being outgoing. Teach social conventions explicitly and create a classroom culture where mistakes are safe. And we also need to support organizational challenges. Reduce paper shuffling between schools and home, and break assignments into smaller, manageable tasks, and offer multiple ways to demonstrate learning. That sentence puzzle activity I use in my AP classes, that's exactly the kind of explicit instruction that helps, but it shouldn't take a teacher creating custom intervention for girls to succeed. They deserve proper diagnosis and support. We also need to watch for emotional sensitivity. We should recognize that excessive emotional reactions may signal ADHD, not just a child being sensitive. We should teach calming techniques and create a supportive, non-judgmental environment. And most importantly, don't wait for academic failure. A girl who's working twice as hard as her peers to achieve average results needs evaluation, even if her grades are acceptable. Every girl and woman with ADHD deserves to understand why she struggled, to receive appropriate treatment, and to discover her true potential, not spend decades believing she's simply not good enough. The cost of inaction is too high. Research shows that untreated ADHD in females leads to higher rates of anxiety and depression by adolescents, an increased risk of eating disorders and self-harm, greater likelihood of substance abuse as a form of self-medication, chronic unemployment despite intellectual capability, relationship difficulties, and social isolation, and profound impacts on self-esteem that persist across the lifespan. As researchers powerfully concluded, it's a condition we can't ignore in girls. It's real and it's devastating. So what can you do? If you're a parent, learn about how ADHD presents differently in girls. Inattention, disorganization, emotional sensitivity, and social struggles are just as valid as hyperactivity. Don't dismiss your daughter's struggles because she's not doing fine in school. Pay attention if she's working exponentially harder than peers for the same results, and advocate for evaluation if you see consistent patterns of difficulty regardless of grades. If you're an educator, challenge your assumptions about what ADHD looks like. Notice a quiet girl who seems lost in her own world, not just a disruptive boy. Recognize that exceptional messiness, incomplete work, and friendship troubles are red flags, and refer students for evaluation based on symptoms and functional impairment, not just academic failure. And create classroom environments where all types of learners can succeed. I wish I had known then what I know now. I wish I had been more persistent in advocating for those bright girls in my AP classes. I did what I could with the knowledge I had, but it wasn't enough. They deserved more. If you're a healthcare provider, update your knowledge about ADHD in females and adults. Screen for ADHD even when patients present with anxiety, depression, and other conditions. Ask about childhood symptoms, even when evaluating adults. Consider ADHD in high-achieving individuals who report struggling despite success. Include questions about emotional dysregulation in your assessments, and don't miss ADHD as a possibility because a patient doesn't seem hyperactive. If you are a woman who suspects you might have ADHD, trust your instincts. You know yourself better than anyone. Seek an evaluation from a provider knowledgeable about adult ADHD and gender differences, and don't let past dismissal stop you from seeking help now. Remember that diagnosis isn't about labeling yourself, it's about understanding yourself and accessing support, and know that it's never too late to get help. If you're a policymaker or insurance provider, recognize that ADHD is a legitimate, chronic condition that persists into adulthood. Ensure coverage for ADHD treatment doesn't arbitrarily end at 18, and fund research on gender differences in ADHD presentation and treatment. Support training initiatives for healthcare providers and invest in public awareness campaigns to combat stigma. For too long, ADHD has been understood through a narrow lens, one that reflects the experiences of hyperactive boys while leaving girls and women in the shadows. This outdated stereotype has caused immeasurable harm, robbing countless individuals of timely diagnosis, appropriate treatment, and the opportunity to understand themselves. But we have the knowledge and tools to change this narrative. Research has clearly documented how ADHD presents differently across gender and ages. Research has clearly documented why girls and women are systematically underdiagnosed, and the devastating consequences of missed or late diagnosis, and the effectiveness of comprehensive evidence-based treatment and practical strategies for improving identification and care. What we need now is action from healthcare providers, educators, policymakers, and society at large. We need to stop asking, does she look like she has ADHD? And start asking, is she struggling with symptoms that could be ADHD? We need to stop waiting for academic failure and start recognizing the girl who's exhausting herself to appear normal. We need to stop dismissing emotional struggles as just being sensitive and start understanding emotional dysregulation as a core feature of ADHD. We need to stop thinking of ADHD as a childhood disorder and start recognizing that adults with ADHD deserve diagnosis and treatment too. Most importantly, we need to listen to the voices of girls and women with ADHD, voices that have been silenced, dismissed, and overlooked for far too long. As one woman reflected after finally receiving her diagnosis at age 53, I'm quite glad things have happened now rather than earlier. I think my age, I'm 53, if I'd been diagnosed with anything at all back in the 70s, what would have happened to me? Who knows? I wouldn't be in this position now, I don't think. So I'm kind of glad I had a late diagnosis, really. People understand it more now. While we can be grateful that understanding is improving, we cannot accept that girls and women should have to wait decades or a lifetime for answers. Every year of untreated ADHD represents lost potential, unnecessary suffering, and missed opportunities. The stereotype of ADHD as a hyperactive boy disorder has done enough damage. It's time to challenge these outdated assumptions, expand our understanding, and ensure that every person with ADHD, regardless of gender or age, has access to timely diagnosis, comprehensive treatment, and the support they need to thrive. Here's the hopeful truth. ADHD is highly treatable. When properly diagnosed and managed, individuals with ADHD can thrive academically, professionally, and personally. The research is clear that early intervention and comprehensive treatment dramatically improves outcomes across the lifespan. Those former students of mine who reached out years later, many of them told me that finally getting diagnosed and treated changed their lives. They finally understood why they struggled. They finally had tools that actually worked. They finally stopped believing that they were fundamentally broken. That's what proper diagnosis and treatment can do. It doesn't just manage symptoms, it transforms lives. The question isn't whether we can do better. The question is, will we? Will we educate ourselves about how ADHD presents differently in girls and women? Will we advocate for the quiet girl in the back of the classroom who's struggling just as much as a disruptive boy, even if her struggle looks different? Will we listen when women tell us they're struggling, even if they manage to appear successful on the outside? Will we update our diagnostic criteria, our screening tools, our training programs, and our assumptions? Will we commit to ensuring that no more girls spend decades believing they're not good enough, when the real issue is a treatable neurodevelopmental condition? I hope the answer is yes, because every girl and woman with ADHD deserves better than what we've given them so far. Thank you for listening to this episode on gender and age gaps in ADHD diagnosis. If this resonated with you, whether you're a parent, educator, healthcare provider, or someone who suspects they might have ADHD, please share this episode with someone who needs to hear it. And if you're a woman who's spent years believing something was wrong with you, who's worked twice as hard as everyone around you just to keep up, who's been told you're too sensitive or not applying yourself, please know that you are not alone, and it's not too late to get answers. Join me next time as we continue exploring ADHD across the lifespan and what it really takes to support neurodiverse learners in reaching their full potential. Until then, remember, different doesn't mean deficient, and struggling doesn't mean failing. Sometimes it just means you need the right support.